Okay, thank you very much for joining me today. I'm David Aronoff, the director of the Division of Infectious Diseases at Vanderbilt University Medical Center. And we can go to the next slide. So the goals of this briefing are to review the latest COVID-19 data from the state of Tennessee and look at some trends that are informing our recommendations around mitigating this pandemic in our state. Next slide. So the basic agenda for today is to think about some of the data that we use when we're thinking about ways to mitigate the threat of this pandemic, tactics that we can take at the state and local levels, and then look at what the data are telling us about where we are and where we need to go. We'll also talk about where the data show our state is headed without more physical separation of people, and then I have some time for questions and answers. Briefly, right now we have nearly 2,000 cases documented in Tennessee, and here we are at the end of March. The very first case in our state was diagnosed on March the 4th. As of yesterday, we had 13 fatalities reported. Just this morning, the Metro Nashville Public Health Department reported 541 cases of COVID-19 in Davidson County, which was an increase from 443 cases reported just yesterday. As we know, the vast majority of infected people either have mild symptoms or are asymptomatic, and about 15% of people will be more severely ill and may need hospitalization. And we're learning that maybe around 1 out of every 100 people will die of this infectious diseases. Recall that as of now, there are no vaccines and there are no proven effective therapies beyond hospital supportive care against this pandemic. So a lot of what we're focused on are efforts to slow the spread of this pandemic so that our healthcare infrastructure isn't overwhelmed by the vast number of patients who are getting sick. And the best way that we can do that to block transmission is really to separate people from one another where people can be transmitting this virus asymptomatically. The virus is transmitted through respiratory droplets that we emit when we speak, or particularly when we cough or sneeze, and that drives a lot of our recommendations about social distancing. But we can also get the virus on our hands and then touch our eyes, our nose, or our face and get infected that way. So good hand hygiene is a really important component of prevention. So the two keys are physical distancing and hand hygiene. And we're really focusing on flattening the curve to slow the spread of the virus. And we can go on to the next slide. So this slide was compiled with publicly available data, and it was made on March 19th. So this is about 2 weeks after the very first case was documented in Tennessee. And you can see on the upper left, the cumulative cases reported over time has grown steadily up till March 19th. New cases that day had been, day by day, had been reported as shown in the bar graph. And then what we call a heat map of the state of Tennessee, which shows the density of cases across the state, clearly shows that this was mostly centered at that time in Davidson County, in and around Nashville. And this was prior to most major tactics around social distancing. A few days before this, on March 16th, the White House had issued 15-day guidelines to help prevent the spread by limiting transmission and really starting to get the message out there about social distancing. If we can take a look at the next slide. So this next slide is from yesterday data, and it's a little harder to see, but on the left upper side is the same cumulative number of cases over time, but now we're also seeing cases of hospitalized patients and people who have died, up to the number 13 that was reported yesterday. The map in the middle of Tennessee were new cases just reported in the past 24 hours. But I want you to focus on the bottom heat map. That's the state of Tennessee again, looking at cumulative cases reported in the state. And not only is Davidson County continuing to be an epicenter, but now we're seeing Shelby County, which is where Memphis is, and other regions of the state involved. It's hard to find by yesterday, a county that's not affected by COVID-19. And that's just 11 days of growth from March 19th to March 30th. If we go on to the next slide, we show both of these maps next to each other, March 19th compared to March 30th. And you can see a pretty dramatic spread of the virus across the state. If we go to the next slide, it shows these cumulative cases again. Starting in early March, the bottom of this graph are days, and the side of the graph are the number of cases. And you can see this steady, persistent rise in cases. On March 23rd, we had Governor Lee deliver Executive Order 17, which really focused on emphasizing the importance of social distancing, having people limit gatherings to below 10 people, avoiding dining in restaurants and bars, essentially closing or suggesting to close gyms or fitness centers, and recommending the use of takeout food or delivery. Executive Order 18 was about limiting elective medical and dental procedures. And then yesterday we heard, after there were 13 deaths and more than 1,800 cases, Executive Order 22, which is essentially a safer at home order to urge people to stay at home and urge the closure of any non-essential businesses, urging people to work from home, et cetera. And you know, notwithstanding yesterday, but prior to yesterday, we can see just a persistent and increased climb in cases, despite having some really good advice about staying at home and participating in social distancing. And this suggests there's more that we can do as individuals to flatten the curve and stop the spread of virus. If we look at the next slide, these are data from a national source, again, looking specifically at Tennessee. And the axis on the bottom are dates. The black bars are cases of COVID-19, very similar to data we were just looking at. I think there's one date around March 28th that's missing from this, but essentially the data are complete. But I want you to focus on that squiggly orange line. And that is the change in average mobility of people based on, I believe, cell phone data. And you can see that there is, over time, a gradual decrease starting at about March 16th or so of social interactions or social movement based on these cell phones. But our state still grades nationally at a C level, which means there's been about a 20 to 30% decrease in average distance traveled by people. These data aren't granular. They don't tell us exactly what the purpose for that movement was, but they do suggest that there's more we can do in this space. If we go to the next slide, this is a model, and there are many models out there that are similar, that estimates the dates that we may overrun our healthcare capacity if we're unable to limit the number of infections over time in our state. The solid blue line is looking at our limit of our hospital beds, and the dotted blue line, which starts to really go over that solid blue line in mid-April, is the actual beds needed to care for patients. There's a green line kind of at the bottom of this graph that's horizontal and shows the number of ICU beds, and those also would get overtaken if we don't do more in mid to late April. Similar things could happen with our protective equipment for healthcare workers or our ventilators, for example. If we're not able to flatten these curves, we could face really important shortages in hospital beds, ventilators, personal protective equipment, and all of that can put our all persons in Tennessee at risk for being sick and not being able to get the care that they really deserve. Next slide. So some key takeaways from what I just showed, comparing the March 19th heat map before significant interventions and tactics like public service announcements, urging of social distancing, with that of the March 30th heat map, suggests we haven't yet seen the kind of mitigation we'd like to see in the spread of COVID-19. Despite all of this activity, it seems that the problem is still getting worse. And these are the kind of data that motivate us to want us to do more. So the one tactic we know guarantees to mitigate the spread of this disease is doing all we can to keep people separated as much as possible, and of course also engaging in hand hygiene. And so stay-at-home orders, I think, are really important. They send a very important message, and certainly one important message that I have is that I want the persons living in Tennessee who are watching or able to hear about this to do everything they can to be safe at home, to really take the Executive Order 22 very seriously, and to continue to encourage our government leaders and public health policymakers to be staying very attuned to the data and asking what more can we do to help save lives in Tennessee. I think that's the end of my slides, and I'm happy to take some time for questions.
All right, Dr. Aronoff, looks like our first question is from Brett Kelman. Go ahead, Brett.
Hey, can you guys hear me?
We got you.
Okay. Thank you very much, Doc, for that presentation. Some of that data I had not seen before, and I thought was particularly interesting and I'm excited to dig into. Most of what I just saw you go over was publicly available data that has been released by the State Department of Health over the last couple of weeks. And it looks like you have done a lot of the same things with it that some of the journalists at the Tennessean and other people have as well. What I wanted to ask is if you feel like anything critical is missing. As you were building this presentation from this publicly available data and wanted to say important and meaningful things about the outbreak in Tennessee, is there anything you didn't have that you felt you should? Were there gaps in this data that you thought was important?
Well, I think something that is certainly on the minds of a lot of people in public health and in terms of communicating is knowing where deaths are occurring, for example, at the county level. I think that would be helpful.
I think, Doc, I think you fuzzed out for the first half of that statement. Would you mind starting at the beginning of your sentence for me?
No, I'm sorry. Can you hear me right now?
I can.
Okay. I think a little more granular detail about where we're seeing severe outcomes like death at county level could be helpful as well.
Why?
Well, I think, again, it helps us get a better idea of where we may be up against healthcare resource utilization. It may give us more idea of where ICU beds are needed or being used. It may help in terms of thinking about deployment of resources, for example. So I think it just provides more context as to the disease and helps us convey some understanding to the community about what they should be doing to prevent the spread.
All right, and our next question is from Stacy Case. Stacy. You should be unmuted now. Oh wait, try now. All right, Stacy. All right, we'll come back to Stacy, and it looks like Peter White. Go ahead, Peter.
Okay, I just unmuted myself. Can you hear me?
Yes, sir.
Dr. Aronoff, thank you very much for doing this. I sent your office some questions. I'm on deadline today, and I want to actually step back. Everything that you've said, I think, is important, and I think the journalists working this story are doing our best to get those pieces of advice about social distancing out and everything. But I wanted to talk to you about your specialty a bit. So I'm concerned that we're still testing, but not testing in the way you as a scientist would test. We're only testing sick people or people at risk. And I understand that that's because we lack capacity. So I kind of want to ask about why is that important to still do? I mean, supposing we flatten the curve as best as we can, right? And at some point our testing capacity goes up, we start doing drive-by testing for, people that are carrying the virus and may not show, that sort of thing. Why is that important, and what can you do with that information analytically like you just did with the presentation slides that you just gave?
Yeah, well, certainly knowing about the dynamics of this virus in our country and in our local community will help us a lot as we think about when the coast is clear and we can start de-emphasizing these recommendations. It is very clear to me that asking people to shelter at home, asking people not to go to restaurants or bars, is devastating to the economy, and particularly here in Nashville, where musicians are out of work and restaurants are shuttered. And it would be very nice to have the best understanding we can as to when we think it's safest to tell people the coast is clear, you can get back to work. And I think our public health experts' ability to tell us when that point will be will depend on how good our data are in terms of knowing where the virus is. Are people still symptomatic from the virus versus allergies or other causes of problems? And certainly if we see what looks like a new outbreak cropping up somewhere we didn't expect, it'll be really important to be able to contain that, but we'll need testing to help guide the way.
All right, next question we have is from Phil Williams. You're unmuted.
Good afternoon, Doctor. I have a question. You had the slide showing hospital capacity, ICU capacity, ventilator capacity. From what you can see from the data, is it inevitable that we are going to reach that capacity, and it's a question of how much we can stay close to that capacity? What do you think the future holds for us right now? What's your message on that?
Yeah, well, I don't make those models myself, and I depend on a lot of people who are making models like this to give us warnings about what we may be in for if we're not stacking as many cards in our favor as we can to try to limit a surge of patients to the healthcare system at or around the same time with severe symptoms from COVID-19. What we think works is really social distancing, like we just talked about. And so all of us in the healthcare provider space are nervous that we could run into shortages on hospital beds or ICU beds or ventilators or personal protective equipment. And part of that is driven by the fact that we've actually seen that happen in parts of the United States and other parts of the world. So, I certainly hope that we don't end up in that space in Tennessee, and I don't know with certainty that that will happen, because I still have a lot of optimism about our ability right now to engage and to do the things that we as individuals need to do to flatten the curve, to slow the spread. So that may be the best answer I can give you, which is some uncertainty there.
Do you think the state, the Lee administration, is fully aware of how bad it could get, and you have a message for them?
I do think so. I think they're very plugged into local and statewide departments of health. I think they're looking at data for sure, and they're very concerned about it. I think we've seen an acceleration of Governor Lee putting in executive orders that are more and more urging people to stay at home and shelter at home. I think there are still opportunities to do more, of course, to put in ways to enforce or mandate sheltering in place or staying at home and not congregating in groups and staying off of playgrounds and preventing large religious groups from getting together and things like that. I think there's definitely room to do more, but I really do believe that our public health experts and government from the local level up to the state are communicating quite openly about this.
All right, next we have Katie. Go ahead, Katie, you are unmuted.
Hi there, doctor. So I am in Western Tennessee in Memphis, and I think one of the biggest concerns here is that we are butted up against two states that have also not issued shelter-in-place orders. And so when you look at this modeling, I mean, it doesn't necessarily capture that, right? It captures it on a state level. And so what would you sort of say to communities like Shelby County, where we are really dependent on our neighboring states? Like, how closely are we going to be impacted by also their orders?
Well, I think you hit a very important question, and I'm glad you asked it because you're living in an area that is very sensitive to what's going on in other states that are outside of the jurisdiction of what we can control at our state level. And I think it's important because the virus doesn't really look at state borders, and the virus can transmit easily from person to person. And so, you know, I think this is a big challenge. So one of the things that could be done, of course, would be to either suggest or mandate self-quarantine for people who come into the state of Tennessee from other states or come in from international travel, for example. But we are really at the mercy in many respects in this country of depending on surrounding states to do the right thing and also to be collecting data on their own. We know that states are even testing at different rates. They have different capacity to test. And that creates a challenge when you have a pandemic that's sweeping around the country.
Yeah, I'm curious though, have you seen any modeling that sort of, instead of, because I think most of the modeling that I've seen so far has been done at the state level. Have you seen anything that maybe takes into more account how a place like Shelby County would be more impacted by Arkansas and Mississippi as opposed to maybe even Nashville?
I have not. It's a really good question, and I think it's one that could be modeled. So if there are modelers out there who happen to be listening, I think that's a great challenge to look at. But I personally haven't seen such models.
All right, we'll give Stacy another shot here. Stacy Case, you are unmuted.
Thank you, doctor. Do we need a shelter-in-place order, an actual order, rather than a safer-at-home suggestion? Kentucky's governor yesterday, for example, instructed Kentucky residents not to come to Tennessee. He says Tennessee is not doing enough.
Well, I've been a champion of shelter in place. I think it is a good idea during this time where we're seeing really an increase in cases fairly dramatically over time here. I think it would be prudent to do that. You know, I certainly want to give the governor credit for doing the kinds of things that he's doing, but I do think there's more that we can do, and I think that a shelter in place would send a very strong message, and it would give the state the capacity to enforce, to make sure that people, you know, we like to have faith that people will do the right thing, but sometimes we don't always, and playgrounds can look awful tempting on a sunny day, and it can be very tempting to go on little group excursions or play sports together when the weather's nice and we're young and healthy. And we forget that these things can really matter when it comes to a pandemic.
All right, thank you, doctor, and thank you everyone for joining. I will circulate the video and notes and presentation after the call. Thank you.
Thank you all.